Hey y'all, I'm Michelle, the Roaming Dental Hygienist in my bathroom, and I'm going to show you what I do as a dental hygienist on my nightly oral care routine. Now, I'm going to be real honest with you guys. I switch it up a lot. I'm always using different products and trying different things. I think it also depends on like, what did my day look like, right? Did I have a lot of red wine? Because it happens. Did I have a lot of coffee that day? Do my teeth feel really dirty? Like there's a lot of stain on them. You know, if you eat a lot of sugary things, you get that film on there. Like, how do I feel? And that's kind of how I decide what I'm going to be doing. So I could do things where I switch up even my toothbrushes. So this is going to be my electric toothbrush. I use the Process electric toothbrush on a regular basis. I have quite a few that I might switch out, but this is like my go-to one. I have my toothbrush little indicator on there that's going to help make sure that I am always brushing everywhere properly. It's just data, just having good data. I like it. But I also switch between my feathery soft bristled brush with the tapered bristled brushes that I do very much love, and then a brush that has none of the bells and whistles of the tapered bristled brushes. I like this for more like stain removal. Sometimes my teeth feel real dirty. I like to, get in there and have a good scrub. But this is still extra soft, and this is called a hybrid soft. I also switch between a lot of my toothbrush heads for Process. They have so many, so I'm like, why? So that's that. I also will switch on my toothbrushes or my toothpaste. I don't honestly use a lot of mouth rinse. I might occasionally for breath freshener, or if I am using, let's say, maybe a straight baking soda for my abrasive instead of a toothbrush or a toothpaste, I might do like a fluoride rinse afterwards just to, give myself some of that fluoride for the day. But first, I start off with toothbrushing or interdental care. A lot of times, though, I'll be real honest with you guys, I do interdental care, meaning I clean between my teeth with floss, a water flosser, an easy pick, an interdental brush. I do that throughout the day. I'm not like I do it in my bathroom. I do it, and there's other videos that you will find on the storefront that will kind of show you those things. So I just kind of dive straight into my toothbrushing unless I'm feeling like I got a lot of time. So I'll choose today my softer but stiffer bristled brush, and that is because of red wine, if I'm honest. So I like this. I'm going to choose right now one of my Sensodyne toothpaste because I have been whitening, and Sensodyne has the potassium nitrate. It is a fabulous toothpaste to help with that sensitivity. Love it. And I need a little abrasivity. Like I said, I had red wine or any other coffees, things like that. Instead of using something like my Live Fresh gel, I'm going to choose something with some abrasivity to it. So I'm going to do this first. I'm going to do it with my toothpaste. And guess what, y'all? You hear me? Listen to me. I am not going to rinse this out. I am not rinsing this out. I'm not even going to get this wet. I'm going to put toothpaste straight on here, and I'm going to put this in my mouth, and I am going to brush. I'm not wetting it. And then when I'm done, I am going to spit the excess out. The end. Sometimes people don't want to spit this, or they feel like they need to spit this out because they put too much on there. So then it's like real foamy, real annoying. So I'll show you what a dollop of that looks like. Okay. And then I'm probably going to get in there with my compact Tuft brush that is going to be these densely packed bristles. I like that for just getting like single tooth. I like it because that's going to get the stain on the backside. A lot of people that get calculus and tartar right here, just individual tooth. And that's going to get a lot of the stain off. If I'm feeling like things are rough, I might do a little baking soda because that's a nice abrasive that will help break up that biofilm and that staining. and I'll just use that. And then I'll use my tongue scraper. This was the one from Tepe. It has 3 rows of bristles, or not bristles, 3 rows of, I guess just call them rows, just rows. So you're getting a pass of your tongue each time. So like you're clean, 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 and you just scrape until you don't see anything on there. This is made from a bio-based plastic. It's from sugar cane, so it's good for the environment. And it's dishwasher safe. So if I get sick or dropped it or dropped it, I would put that into the dishwasher now. Like I said, I might rinse my mouth out, but that is going to be based on a few things for me, and this is how I guide a lot of my patients. What toothpaste are you using and why? So if you're using something with a high fluoride count, I don't want to rinse that out, right? Like something more prescription, like 5,000 parts per million fluoride. I would not want to rinse that out. So I'm going to let that fluoride sit in my mouth for as long as possible. I don't want to rinse the rest of it out. Now, I also would say maybe if you felt like you just ate and you need to brush your teeth, I don't really encourage brushing about 30 minutes after you eat or within that 30-minute window. But you could use something like a Closis or something with a real neutral pH to neutralize your saliva, neutralize your mouth, because every time you eat and drink, you drop the pH of your mouth. It's an acidic environment and we don't want to rush around that acid, right? So I would neutralize the pH in my mouth and then I would brush my teeth. So that's how I would probably use a mouth rinse in my particular case. Now, if I felt like I used, like I said, a baking soda with not any ingredients that are going to be helpful, then I'll just let's follow it up with a Closis or maybe the fluoride rinse or a caries free. You can find all of those things in my Amazon storefront. So that's my routine. That's pretty standard. Like I said, the only things that I change and deviate from is maybe my brush head and my bristles, depending on what I've eaten that day. If my teeth feel dirtier than other days, I will probably use my compact Tuft brush almost every time I drink wine or anything with a lot of staining factors to it. I'll choose my toothpaste depending on my whitening, if I want a little abrasivity, and then I'll do my tongue cleaner. I also do encourage dental cleaning between the teeth. If you have not done that at all during the day, this is a great time to do it right before you go to bed. But that's my nightly routine with all of my favorite oral care products that you can find in my Amazon storefront.